Good afternoon, everyone. Welcome. Thank you so much for joining us here today and for spending this afternoon with us. We are absolutely delighted to have Josh Gitalis with us here today. He will be speaking about fasting unlocked, the biochemistry revealed. My name is Elizabeth Papadopoulos. I'm the director of the Institute of Holistic Nutrition, and we will be starting very shortly. Josh Gitalis is a Toronto-based worldwide industry leader in holistic nutrition. He has a busy private practice. He graduated from IHN in 2007 and is recognized as an expert in integrative healthcare, where he merges the best of functional medicine and integrative therapeutics. He has taught clinical nutrition at several natural health colleges and runs a functional nutrition certification program. He is also the first Canadian nutritionist to become an Institute for Functional Medicine certified practitioner. And let us welcome Josh Gitalis.
Thanks, Elizabeth. I am very excited to be here. Thank you very much for inviting me, and really looking forward to talking about fasting today. I'm just going to share my screen so you can see my slides here, and we will get right into it. Okay, so welcome everyone. Today we're talking about fasting unlocked, the biochemistry revealed. And as I'm sure all of you have experienced with learning at IHN, is that we spend a lot of time talking about what we should do and what we should eat, right? We often forget about or don't put as much attention into what we shouldn't do and the absence of, and what types of benefits can result from actually taking out certain things. And everything in functional nutrition, clinical nutrition, holistic nutrition, whatever label you want to give it, functional medicine, is about two things. One, what do we have to take out? And two, what do we have to put in? Right? So sometimes we have to take out processed foods, we have to take out habits that are harmful, we have to take out chemicals, sometimes we have to put in certain foods, sometimes we have to put in certain nutrients. But today we're actually be talking about taking something out, and we're going to be looking at both sides of it. So my first question for you, joining me here today, is how many of you have ever experienced or practiced any type of fasting? And you can just let me know, how long you've tried, maybe what type of fast you've done. And hopefully by the end of our little chat today, it will inspire you to maybe try some of this type of fasting for yourself. Definitely implement it even with some of your clients. So I see that we have people that have done 72-hour fast, intermittent fasting, 14 to 16-hour fast, 21-day juice fasts. There are so many out there. We will cover a bunch of them, and we can definitely talk more about them as we go along here. But I would argue to even say, those of you who said you have never tried any, actually do one by default every single night when you go to sleep and are in a fasted state. As we progress here, we'll be looking at what is actually going on biochemically in the fed and fasting state, what that means, and how we can bolster the mechanisms that are beneficial for health and longevity. Before I get there, I want to introduce you to my friends. This is Canto and Owen. They, at the time of this study, they were 25 and 26 respectively. They are rhesus monkeys, where they did a study on how caloric restriction would affect their health and longevity. So a rhesus monkey lives for about 27 years on average. That's their average lifespan. So you could imagine a 25 and 26-year-old rhesus monkey are considered pretty old, right? Like they're in their final stages of life. So we've got two monkeys here. Our friend on the left, Canto, 25, would be fed about 445 calories per day. Owen, on the other hand, would get about 885, almost double what Canto is getting for the duration of their lifespan. And what they found at the conclusion of the study is that Canto, at 445 calories, had a nice coat, elastic skin, a smooth gait when walking, upright posture, was very energetic, and the biochemistry, the blood work, was all really good. On the other hand, our friend Owen, who was eating more than, about double, had arthritis, the skin was wrinkled, the hair was falling out, he was frail, he moved much slower, and he had high blood glucose and triglycerides. You can even see in the picture that Owen looks like he's in a bit more rough shape. If we think about an older person, we think about them hunched, who weren't taking care of themselves, and he's quite hunched. The Canto looks quite lively and sprightly here. So who would you want to be in this situation? Probably Canto. He's the cool one here. He's the guy that is still living the best life, even in the final stages of life, right? And the only difference between the two of them was caloric restriction, was a lower calorie diet. Now, as I've progressed over the years, almost 20 years of doing this, learning about nutrition and health and what it takes to move people up what I call the slope of health, and what it takes to improve longevity and the health span rather than just the lifespan, there are certain things I come across that are pretty strong inflection points in my life where I'm just like, oh my God, I have to apply this. This is a big eureka. I first learned about fasting I learned many years ago. It was mentioned in school. Michael Murray talks about it in his books, water fasting, but I never really implemented it with my clients or even myself quite often until I attended a conference in 2018 and I heard Dr. Walter Longo speak. And what he shared with me at that conference just blew my mind. And right away, I'm like, I have to try this for myself. And I have to do this with my clients. It's a no risk or low risk, zero cost type of intervention, which can have massive benefits, which we'll see quite soon. One of the first thoughts that I had, though, was I can't do that. Have any of you ever experienced that, where you learn about something new that would be a drastic lifestyle change, and your immediate thought is, I can't do that? Or you're telling someone about some type of intervention or some type of dietary or lifestyle change, and they say, I can't do that. What I like to examine when that word can't comes into play is it I can't or I won't? I can't is really I won't with an excuse, right? So I'm going to show you today that we can all do fasting in some way. There's no one that basically can't do it. Yes, there are definitely some contraindications, but for pretty much every healthy person out there, there's a path to trying out some fasting. We were all born with powers. Okay, I like to call these powers because they can produce some very powerful results. We're born with powerful rejuvenation and repair mechanisms embedded in our DNA as part of our biology. It's a matter of knowing how to turn them on to their full capacity. And I want to show you the tips and tricks and the ways that you can do that, of course, with our discussion today with fasting, and a couple little sidebars as well as we move along here. Our genes are based on hunters and gatherers that lived on this planet as Homo sapiens for 2.5 million years. Now, over that span of time, we didn't have a regular supply of food, right? We were hunting and gathering. And in that lifestyle, we had times where we had less food, no food, and there were times when we had lots of food. So our brains are in the present, but our genes are in the past. It takes about 10,000 years for the genes to even change a fraction, okay? It takes a very long time for that to happen within the human body and with evolution. Our brains are in the present. We're in a state where at every corner there's a grocery store. At the touch of our phone, right? We can order food and it comes right to our front door. We have access to calories pretty much all the time, anytime, and any way we want it. But the genes that run the show, that are the code, that is the information of this body, are way in the past, and they work by many different rules, many of which we're not in line with today. Speaking of the past, many religions, many practices have been in our mythology for many, many years. Here's a few examples. We've had a lot of situations where we might call it spiritual fasting. And if any of you have ever tried fasting, which I see a lot of you have, you know that it's not just a physical practice, it's a spiritual practice as well. And there's a lot to learn from the experience. So going all the way back to the story of Adam and Eve, they had the forbidden fruit, which they were supposed to turn away from and resist temptation. Greek Orthodox Christians have various fasts that they do for up to 200 days a year. And just as an example, in Crete, where there's a very high concentration of Greek Orthodox Christians, they have a very high longevity. Buddhists often fast afternoon, and they may do water-only fasts for days, even weeks. In Hinduism, sins lessen as the body suffers. So they use fasting as a form of suffering to release some of their sins. Muslims have Ramadan. I remember in university when I was in residence in my first year, we had some Muslims in our building, and they had breakfast for them before the sun came up, because they're allowed to eat when it's still dark out. They're not allowed to eat when the sun comes up. And some of us took advantage of that as well. We called it a Ramadan breakfast, which is quite delicious. And then Judaism, my religion, I'm not a serious practicing Jewish person, but it's been in my world my whole life. And we have holiday Yom Kippur where we fast for a day, and a couple other times where fasting is part of that. So it's been in culture for many years, and probably for good reason, because we've noticed that it helps with spiritual development and it's really important for physical health. But what has happened in our society is that we find people are eating more and more often. So as you can see here, the numbers of meals and snacks have increased from 3 per day in 1977 to 6 per day in more recent times, 2003 to 2006, when the study was completed. So you see a shift in literally the amount of food that people are eating. I probably don't have to, preach to the choir here, but we can all appreciate that we're eating more and more, and we have access to more and more. So a question I want you to consider is, how long can we safely fast for? Like, how long can we actually go without food? We know that water, you can't go more than a few days without water. Anyone with any basic survival training know that you have to find a good water source pretty quickly in order to survive. Food, on the other hand, takes a little bit longer, right? We can last a lot longer with food. I was recently watching a show entitled Alone, where they dump like 10 people by themselves in the wilderness, and these people have to survive for as long as they can. And whoever's the last person standing basically wins the show. But they're all by themselves. They all do their own videoing. And a number of the contestants were discussing their strategy, and they said basically they just tried to get as fat as they could before the show so that they can live off those calories while making shelter, while finding water, while finding food sources, and getting those pieces in order. It was a pretty good strategy. So as I mentioned before, we have food everywhere, right? It's abundant in grocery stores, corner stores, even ordering online. Now, any of you have any guess as to how long the longest fast was on record? Any ideas here? We have a couple guesses. 3 weeks. Another person said 300 days, over a year. 900 days. I think 380. 21 days. 40 days. About 385 days. Oh, that's probably one of the closest guesses by Heather. So yeah, so it was 382 days. He holds the record, Angus Bibiri, for the longest fast. He lived on tea, coffee, soda water, and vitamins. But how did it all begin? They were doing a study, I believe it was in the UK, with obese individuals. It was supposed to be 14 days. They were under medical supervision in a hospital through this fast. And this individual, Angus, he was at a starting weight of 456 pounds. He enrolled in the study, and when the study was over, he was so impressed by the results and how he felt, he just kept it going, and he just stayed on the fast. He lost about 276 pounds through his whole fast as he moved past a year, and he stopped at about 180 pounds. But after a certain point, he was very low on electrolytes, so he had to add some vitamins, but pretty much he was on no calories for that period of time. So that's a lot of energy stored up within our body, right? Now, obviously, most of us are not 456 pounds, but we still have months and months and months of energy stored within our body to sustain life. Not saying you should go that long, that's a different discussion, but we can all fast. There's so many different types of fasting out there. I mean, just revealed by the answers when I asked you if you've ever had experience with fasting, so many different types came up. These are just a few. We have overnight fasting, which pretty much all of us do unless we're waking up to eat. Intermittent fasting, time-restricted eating, something called the fasting mimicking diet, which was popularized by Walter Longo, which I had mentioned earlier. Water-only fasting, different time fasts like 12, 16, 24, 36-hour fasts, and even 2, 3, 5-day fasts as well. So there's a lot of different ones out there. There's nothing really standardized at this point. Here's what we know about fasting, though. We know quite a few of the biochemical mechanisms at play and how they're working and what they're doing in the body. We also know the effects on a selection of diseases and conditions. The research is coming more and more showing us how we actually apply the fasting techniques clinically and to which specific conditions do they actually improve. Now, I would argue that almost every condition can be improved through fasting, almost every. We're just accumulating the data at this point in time on how it can help us. Now, an interesting little side note is that our organs actually shrink with severe caloric deprivation. In many of the studies that have been done with rodents, they find that some of the organs can decrease in size by up to 40% through prolonged fasting. Now, the cool thing is there's a 1-2 punch here. Part of the magic of fasting is actually the refeeding, which we'll look at in more detail coming up. But when the animals lose 40% of their organ weight, when they start refeeding, they gain it all back. And these are new, vibrant cells within the body that regenerate the organ, if you will. Now, there's two exceptions, which probably has some evolutionary reasons why this is the case. But the brain and the testicles in males do not shrink when we're in a fasted state. And I would say that it's probably for good reason. You know, we need the brain and the testicles in order to keep the human population moving on in times of famine. So, you know, nature always has a great plan for us. Here's what we do know, what we don't know. Not all of the biochemical mechanisms are known when it comes to fasting, so we're still learning a lot at what's at play here. We don't always know how to tailor the fasting to the individual. And I think we're starting to learn more and more on this topic as we look at it for the individual rather than the population, right? And that's what we do, right? That's what it's all about when it comes to, you know, clinical nutrition. Functional nutrition is about tailoring it to the person in front of you rather than for all. How often we need to do fasting? So I think, again, it's going to vary from person to person, and especially depending on what you might want to address in terms of a condition or a main concern. What the long-term effects are of fasting. Sex-specific fasting regimens. We're still learning a lot there and how it might affect the hormones. And what will, I put in quotes, break a fast, because there are certain things you can eat and even drink and be exposed to, supplements you can take that don't necessarily break the fast, but you're still consuming something, right? So they still allow the mechanisms of the fast to continue for you to get the benefits. Okay, so we're going to dive into the biochemistry now. And in order to understand fasting much deeper, we have to understand both the fed state and the fasted state. We have to understand the flip-flop here. We're going to start with the fed state. What happens when we eat? One of the first hormones that's released is insulin. Insulin's released, and it helps us to use food as energy. And whatever is left over, it will store those calories. It's a wonderful system. And I like to think about insulin as a factory. Well, not the insulin as a factory, but think about a factory and needing to get your load in your truck into that factory, right? You just pulled up, you have all the items the factory needs. And what insulin does is it goes to the front desk of the factory and it says, hey, I've got a truckload of glucose back there. Would you mind opening up the hatch so we can bring in the load? And that's how insulin works as a signaling molecule. It goes to the cell, tells it to open up the doors for glucose, and the glucose comes in, gets utilized as energy. Whatever's extra, insulin will help the body stash it away and store it. Okay, so insulin's a very important hormone, which we'll talk about a number of times. Now, I think we can all understand that when we're burning the energy or the glucose, the fuel that we've just consumed, it gets used up and that's it. However, when we have an excess of fuel, we have a couple options in terms of our energy storage. And not only when we're burning it up, but also when we eat, we will store it away, some of it away. We have two places we can store it. We'll talk about each sequentially. So the first is as glucose and glycogen, and the second is as fat. Now, our muscle and our liver are our storage units for the glucose and glycogen. Okay? Now, glycogen is just a lot of glucose molecules put together, right? So it's long chains of it. Now, we only have a certain amount of storage in these two tissues. In our muscle, about 1 to 2% of the muscle mass is made up of glycogen. And that equates to about 400 grams of glycogen, which is equivalent to about 1,600 calories. And this is important to note because it will help you to understand what's happening over time in the fasted state and how quickly we can switch over to burning different forms of energy. So think about it, 1,600 calories, which I would say is maybe a little bit less than I would burn in a day or the average person in a day. It sort of depends on your weight and activity level. In the liver, we don't have as much space, but we can store glycogen there as well. It makes up about 5 to 6% of the weight of the liver. And we can store about 100 to 120 grams of glycogen in the liver, which is about 400 to 480 calories. Just to give you a bit of a gauge, about 200 to 300 calories are burned per hour of weight training. Just to give you a bit of an idea of what that all means and how the numbers relate to each other. Okay, so we can store in the muscle and the liver. Once those storage units are filled up, we convert that energy into fat. We can take that glucose, we can take the glycogen, we can convert it into fat. Now, here's how we can understand how that works, okay? Think about a fridge that has all the food and groceries that you got for the week, okay? Think about that as your muscle and liver glycogen, okay? You have all your food that you're eating, pretty quickly, or else it's going to go bad in your fridge. But you also have a deep freezer where you have a lot of extra food, frozen stuff you've made, other meals, maybe some frozen meats, anything that freezes well that you can save, maybe berries from the season earlier that you saved in some bags. And here's the thing, most people have like one fridge, right? But the deep freeze, you can have as many as you want, okay? And that's like the fat stores in our body. So there's only a certain amount of space in the fridge, but the deep freezers, we have unlimited space and we can keep on buying more and more and more deep freezers. In other words, we can make more and more fat. When insulin is low in the fasted state, we can easily tap into the freezer and use that storage, that fat storage as energy. We also trigger fat burning when insulin is low, okay? And that's a form of really good metabolic flexibility, which we can talk about more later. So metabolic flexibility is the idea of being able to switch from different energy sources. Do I want food from my fridge, glycogen, carbs, or do I want food from my freezer, more fat? So that fat storage has an unlimited ability to basically multiply and store. As we saw with our friend Angus at the beginning, right? He almost got to 500 pounds. Now, in that storage form, we have fat stored as triglycerides. It's really a brilliant model. So we have this backbone, which is glycerol, and then we have 3 fatty acids attached to it, which is why it's called a triglyceride. And this is how our fat gets stored. Now, most organs can use fatty acids for energy. So the liver, kidney, the heart, the muscles can actually use fatty acids for energy. The renal medulla, so like the inner part of the kidney, red blood cells, and the brain cannot use fatty acids. They need a different type of energy source, which we'll talk about in a moment. Now, when we need energy or we're liberating energy from our fat stores, we take those triglycerides, we break off those fatty acids, and we convert them into what are called ketones. The glycerol backbone can be converted into glucose through gluconeogenesis. So, I think the way fasting is spoken about a lot and different diets like the ketogenic diet is people think like their blood glucose is just going to go to 0 when they stop eating carbs. But If it went to zero, we'd all be dead. We're always going to have some level of glucose in our bloodstream at any one given time. Interesting side note. Does anyone know how much glucose we have in our blood at any one given time? This is really interesting. So is it like a sprinkle of, let's just think about sugar, if we're quantifying it in the amount of sugar, is it a sprinkle? Is it a quarter teaspoon, a tablespoon, a cup, 2 cups of sugar? How much sugar do we have in our bloodstream at any one given time? Think about what's in our liver and muscles. It's probably like 5 plates of pasta worth of glycogen in our muscles, but how much is in our bloodstream at any one given time? This blew my mind the first time I heard it too. And the answer is about 1 teaspoon of glucose, 5 grams of sugar. That's a very, very small amount of sugar. And if we get out of that range, we could be in a coma. We could be in big trouble. So it's a very tightly regulated system. Insulin is being released in very, very small amounts, but very effective doses to do what it needs to do. Okay, so going back to our slide here, we've got glycerol that can convert into glucose. So we always, as long as we have fat and triglycerides, the storage form of fat, we're always going to have access to that glycerol to keep the glucose at a certain level. Okay, that's really important to note. And then we have the fatty acids converting into ketones. 75% of the brain's energy can come from ketones. The other 25% would come from glucose, and this would be in a state of ketosis. Now, one important thing to understand, because sometimes these phrases get mixed up, is ketosis is not ketoacidosis. So sometimes people equate ketosis as a dangerous state to be in, which it is not, but ketoacidosis is definitely a dangerous state to be in. And this is something you don't want to get into. It was not going to happen with the typical healthy person, but type 1 diabetics who have lost their ability to make enough insulin because their cells have been damaged that make insulin, can get blood sugar levels that are extremely high. Insulin is not present to move that into the cell to store that away. Blood sugar stays high. Due to low insulin, that sugar is converted into ketones. The ketones get converted to a level that becomes dangerous. Ketones accumulate, and that's ketoacidosis, and that can be a very serious situation. So not to get ketosis confused with ketoacidosis. Going back to insulin, insulin was one of the most astounding and medically relevant discoveries in terms of helping people with type 1 diabetes. So this is patient number 1 when insulin was patented in 1922. And as you can see, this patient on the left is basically wasting away because they can't get energy because they can't make insulin. Once they started getting insulin, exogenous insulin, they were able to get to a healthy weight, and it basically has saved a lot of lives over the years. So insulin's a very important molecule that we cannot live without. Now that we understand a little bit about the fed state, we're going to flop. We did the flip, now we're doing the flop to the fasting state. And this is where things get really interesting in terms of what we can do with this information. So what happens when we fast? What we're going to do is we're going to follow a timeline where we have a meal and then what happens in the hours afterwards when we're in the fasted state. Because as soon as you stop eating a meal, you're technically in the fasted state, right? But certain mechanisms turn on as time goes on. Okay, so let's start with the feeding. We eat a meal, our blood sugar rises because we get calories in, insulin levels increase, okay? So as a response to the blood sugar coming up, our pancreas releases insulin into the bloodstream. Insulin helps us to burn and utilize in the cells what's available in terms of glucose. Any extra gets stored, as we already covered. Now we're moving into what's called the post-absorptive phase. So we've absorbed the meal, it's gone into the bloodstream, and now we have no more calories being absorbed from our small intestine. Blood sugar and insulin begin to fall. The liver starts to break down glycogen, okay, because remember we have the storage form of the glucose in our liver. We have a certain amount there, about 400 to 480 grams. And then that glycogen will last us, the stuff from our muscle and our liver, about 24 to 36 hours. And that is, again, dependent on the size of the individual, how many carbs they had eaten beforehand, like if they had carb loaded, and also the amount of activity that is being carried out by the individual. So if someone is doing more activity, they're going to burn through that a lot quicker. Moving into the 24-hour to 2-day phase, we're moving into some gluconeogenesis, where glucose is being produced from amino acids, and glucose levels fall within a normal range. So I don't know if any of you have ever tried wearing a continuous glucose monitor, but basically what you'll see is that when you stop eating, or if you're on a fast day, your glucose just flatlines. Not flatlines in a bad way, but just it doesn't really go up or down, it just stays really, really constant. Gets in the normal range typically for most healthy people, and then just stays there. There's really no fluctuations at all. Moving into day 2 to 3, we're now getting into a state of ketosis. Now, it does say day 2 to 3 here. You can get into ketosis earlier if you're doing more activity. The low insulin does signal a process called lipolysis, where we start to break down fat for energy. Remember those triglycerides? The triglycerides use the glycerol for gluconeogenesis to make glucose, because we can't have zero glucose in the blood at any one given time. We have to have that baseline level. And fats are used for tissues, not the brain, because the brain needs the ketones and the glucose. After about 4 days, 75% of brain energy will come from ketones, specifically beta-hydroxybutyrate and acetoacetate. Those are the 2 primary ketones that are being used for energy. Now, prolonged fasting, we're moving into 5 or more days. One of the body's key goals is to prevent protein breakdown. It wants to conserve what it has, because protein is really important for survival. We have an increase in growth hormone, which maintains lean tissue. Energy is almost entirely fatty acids and ketones at this point. Blood glucose is maintained with the glycerol, as I mentioned. And we have an increase in norepinephrine to prevent a decrease in the metabolic rate. We'll talk about these counter-regulatory hormones in a moment. So just an interesting chart to understand where we're getting the energy from, specifically the brain, because, when you're in a lack of calories or you're in a fasted state, you want the brain to still operate at a high level. And especially if you're a hunter and gatherer, if you have a lack of food, you still need your noodle to work properly so you can go out and hunt and operate properly to get the next meal for the tribe. In a fed state, most of the energy for the brain can be glucose. In a starvation state, it will come from glucose, beta-hydroxybutyrate, and acetoacetate. And this study they actually used 3 obese volunteers, and they starved them for several weeks. So I'm not sure if studies like this would get approved today, but maybe. And this is what they discovered from that. So the cool thing about these ketones as well, beta-hydroxybutyrate and acetoacetate, I'm not going to get into it in too much detail in our talk today, but they're not just used for energy in the brain, they're actually signaling molecules as well. And we'll look at some of the benefits of those signaling molecules in a moment. So just another way to look at it, we can see it as the 5 stages of metabolism. So if you look at the blue line, that's the food. Right at the left side of the chart here, you've finished your meal. There's no more food coming in, but you're digesting it, and that's the absorptive phase. You're absorbing the food. So at about 5 or 6 hours, it's out of your intestines. You're not absorbing calories anymore. Glycogen levels increase as we store that. And then gluconeogenesis will slowly increase as well. With some metabolic flexibility, we can move to use other sources for energy. Now, this hormone insulin, which is so important, in a fasted state, we can improve our sensitivity to insulin. This is really important. Now, we've all heard of the term insulin insensitive, right? Like type 2 diabetic becomes basically insensitive to the insulin. Insulin is trying to make contact with the cell, and the cell's like, back off. You've just been bothering me for too long. It's like that solicitor that's just knocking and knocking and knocking and knocking. It's happening all the time that the cell starts to resist the message, the insulin, and we get insulin resistance. So when we go to the flip side and we stop abusing carbohydrates and they start to come down, sensitivity to insulin improves. And we see this with a number of cells. We actually can lose sensitivity to cortisol. We can lose sensitivity to, things like serotonin even, people who use SSRIs. Sometimes the drug stops working because the receptors are getting bombarded by the neurotransmitter, and they have to change medications or they have to increase dosage. With cortisol, we see people at first getting great benefits from cortisol release. It has anti-inflammatory effects. But with chronic cortisol secretion, we lose sensitivity to that, and then it can not really do what it's supposed to with decreasing inflammation over time. Lower insulin, we rid the body of excess salt and water as well, because higher insulin can store glycogen. It also has a salt and water retention effect. Another hormone we need to be aware of is growth hormone. So it's made by the pituitary. It peaks during puberty, and it increases the availability of fats. It increases lipoprotein lipase, which is an enzyme which will help break down fats, and it increases hepatic lipase. So hepatic liver, lipase breaking down fats as well. We're going to increase the breakdown of fats to be able to use them as energy. It's a counter-regulatory hormone. So it signals the body to increase the availability of glucose, which counters the effect of insulin when there's the absence of insulin. Now, what actually suppresses growth hormone is eating meals, eating food. So it'll decrease when we eat a lot of food, and overeating can suppress it by up to 80%, a very important hormone which we want released in high levels for rest and recovery and for preserving tissue. The stimulus for growth hormone quite a bit is fasting. And as you can see here in this chart, people fasting over 5 days had an increase in growth hormone as time went on through the fast and in total growth hormone. Cahill did a lot of research on fasting, and this is from one of his papers, Fuel Metabolism and Starvation. So good to know that we're not going to have a complete drop in growth hormone as we embark on some of these fasting regimens. These are the counter-regulatory hormones: growth hormone, cortisol, and adrenaline, okay? Also known as epinephrine. These counter-regulatory hormones will peak just before waking, which is really important because it helps to get our blood sugar up in the absence of food, essentially. It'll counter the effect of insulin, and it'll increase glucose. So it's a really important part of our diurnal pattern of sleeping and waking and being in a fed and fasting state. Okay, so now we understand about the fasted state. We looked at the fed state, we looked at the fasted state, and now we'll dive a little bit deeper into the biochemistry of growth versus autophagy. So we're always having this flip-flop of growth and repair and breakdown and rejuvenation, essentially, right? Getting rid of old cells, which is autophagy, auto, self, phagy, digesting. So what's more important? Do we want to grow? Do we want to build? Do we want to repair? Or do we want to break down? Do we want to get rid of? Do we want to recycle and eliminate? Autophagy the word came from Christian de Duve, who is a Nobel Prize winner, and he got it from the Greek words auto and phagein, which means self and to eat, right? So really, essentially eating oneself is autophagy. We really want to be clear on how to turn off and turn on autophagy. So how do we turn off autophagy? Like, how do we stop ourselves from breaking down old cells? This is also analogous with being in an anabolic state. And there's a few things that are necessary in order for that to happen, or that can have that signaling effect. Glucose, insulin, and proteins, especially the amino acid leucine, okay? And what these do, these are a couple mechanisms that are really important to understand, is they activate something called mTOR. On the flip side, they inhibit something called AMPK, these messaging molecules. As a net result, we experience growth. So you could imagine that this would be really important in situations where we want to grow muscle, to activate muscle protein synthesis, or we're repairing tissues, or we want to really bolster growth because maybe we had a surgery, an injury, or maybe we're a growing child, right? Or maybe we're just trying to maintain our gains in the gym, throughout our later years. Okay, so this is a really important mechanism to keep the body strong, to keep it healthy as well. Also important is the flip side, the autophagy, where it's turned on and we experience a catabolic effect. And we're flip-flopping from this all the time with fed and fasted states. So when there's an absence of glucose, insulin, and protein, autophagy increases. We have a flip of the activation and inhibition. So we inhibit mTOR, we activate AMPK, and we experience this effect of autophagy. Okay. Now with autophagy, we have all sorts of other benefits. So let's just look at those right now. We have mitophagy, which is we break down old mitochondria and build up new mitochondria, which of course are really important for energy production because they're the powerhouses of every cell. We preserve stem cell function. So stem cells, of course, can differentiate into any cell, and they're really important for rejuvenation and repair. We reduce inflammation substantially and inhibit NF-kappa beta, which is also an inflammatory messenger. So with these, with the effect of autophagy and turning on the catabolic state, we also have these messaging molecules like we talked about earlier, like ketones, that can have some profound effects on inflammation and other biochemical pathways. Another interesting one is it improves vaccination response. So what they found is that when people go and they get vaccinated in a fasted state, they actually create better immune responses to whatever vaccine they're getting and have a more robust immune response to that vaccine. So they're really maximizing the effect of that medical intervention. And it reduces senescent cells. So those zombie cells that kind of float around the body, don't do much, but can cause a lot of problems and increase inflammation. Now, there's a number of other ways too that we can activate this pathway that aren't necessarily fasting, but they work with with similar mechanisms to activate some of these pathways to help with cleaning up shop. So hypoxia exercises, HIIT training, high intensity interval training, cold and heat therapies, So cold plunging and saunas and all that good stuff. And even certain nutrients like urolithin A that comes from pomegranate, foods like olives, coffee, green tea, turmeric, berberine, resveratrol, and quercetin. So these can actually help and bolster the fasting process. One of the questions we looked at earlier was, do we need to just basically consume absolutely nothing? Like one question that people ask quite often is, do I have to give up my coffee when I fast? And the answer, we think, is a clear no, because actually the polyphenols in coffee can bolster some of those pathways that give you the benefits when you're in a fasted state. So that's pretty cool too. And it's also nice to know you don't have to give up your coffee if you're in a fasted state. Okay, here are just some of those references that we were talking about. And I want to end just by looking at one study here. So I've worked with a number of people who have MS, multiple sclerosis. And when I heard about this study, my mind was just blown in terms of the therapeutic potential of fasting. I mean, this is just one of many. So, I've used fasting in people for metabolic syndrome, for cardiovascular disease. I've used it for people who are going through chemotherapy and radiation, a lot of great evidence with using it for as an adjuvant therapy going through cancer treatment. I've used it myself for brain health and for energy and for doing a lot of really amazing things. And I've also used it for autoimmune disease quite a bit. This study was done by one of the researchers was Walter Longo, but with a variety of researchers here. And it's entitled A Diet Mimicking Fasting Promotes Regeneration and Reduces Autoimmunity and Multiple Sclerosis Symptoms. So what they were doing here was they would induce multiple sclerosis in these rodents. There's a model that they use, experimental autoimmune encephalomyelitis, where through a process they inject some things into the rodent and it triggers this autoimmune response. So they get a model of MS that they can test. And what they found was that 3 rounds of what's called a fasting mimicking diet actually stimulated the regrowth of the spinal cord. So what you're seeing here is a close-up of spinal cord tissue. On the left, you can see the control. If you look right at the bottom at the green, it's quite obvious that there's a lot more black than green. I'll blow that up for you. As you can see here on the left, the control didn't really have regeneration of the spinal cord. On the right, there was regeneration of the nervous tissue, which is just mind-blowing in my books. And it's something that you have to use when you know this information. So this is just showing the power of some of these fasting regimens. The fasting mimicking diet is a 5-day diet that in the case of the study was 7 days with the rodents, but for human fasting mimicking diet, it's about 5 days, severe caloric restriction to put you in a fasted state. And that's what you do for about that 5-day span. And they did 3 cycles of it with these subjects. So with that, I want to loop back around and ask you the question, is it a case of I can't do it or try it, or I won't? And hopefully seeing some of the evidence, seeing the power of fasting and how we can use it, you might try some experimentation yourself and possibly use it with your clients. I want to thank you all so much for joining me today and listening to my lecture on fasting. I hope you learned a lot. And most importantly, I hope that you apply this information in your own life. Thank you.
A wonderful presentation. Thank you, Josh. Okay, beautiful. So we're going to take some questions right now. And speaking of glucose, we don't need any added glucose because liver can convert fat to glucose. Body's fuel is fat, not glucose. I think Zanata just wants some confirmation on that.
Okay, yeah, I see the questions here now. Now, just to clarify, we are converting triglycerides into two different things. So we're taking the fatty acids from the triglycerides, right? It's three connected to the glycerol backbone. We're taking those fatty acids and converting those to ketones, and we're taking the glycerol backbone and converting that into glucose. So technically, you don't ever need to consume glucose again in your life, and you'd be totally fine. Yes, you would have to consume fat because you need energy. And yes, you would have to consume protein because it is a building block of the body, but you would not need to consume any glucose.
Excellent. Yeah. Okay. Is intermittent fasting suitable for a breast cancer survivor that had a minor lymphoma? How long should she fast? And is there any protocol for cancer clients with fasting?
Yes, there's quite a few protocols for cancer. And to get into the nuance of all of that, I would actually recommend the book, Fasting Cancer by Dr. Walter Longo, which recently came out. It's a fantastic read. And he goes through the evidence for fasting for basically every different condition. Like each chapter is a different one. So we've got a whole chapter on breast cancer, prostate cancer, gynecological cancers. He goes through all the different cancers. So I would urge you to check that out. To answer your question more direct, I would say yes, there's definitely a time and a place for some type of fasting. I've worked with many cancer clients going through cancer in all stages of the journey. Preparation for conventional treatment. Through conventional treatment, research has shown that when you fast while you're going through treatment, it makes the cancer cells more susceptible to the chemotherapy and radiation, and it makes your healthy cells less susceptible to the damage from the chemo and radiation. So it's a powerful dual mechanism that's going to protect you in two ways and improve and bolster the effect of whatever treatment you're getting. And then I've also used it post-cancer treatment for recovery and rejuvenation of the body.
Excellent. And of course, the type of fasting that you would recommend, Josh, would be individualized for that person.
That is correct. We would, just to give you an idea of when I wouldn't use it, if someone is underweight, that's a big red flag. We're not diving into any type of fasting regimen if someone is underweight. If someone is a healthy weight or overweight, we're definitely playing with different fasting regimens to best suit them. Some people tolerate ones better than others. Sometimes you have to do trial and error. Sometimes you have to ease people into longer fasts. Most of us, and this was definitely the case with myself when I first learned about it, have not gone more than 5 or 6 hours with food unless we're sleeping since we're born, right? It is just not something. So some people need to get used to that. They have to improve their metabolic flexibility. They have to become familiar with what it feels like to be hungry for prolonged periods. And just as a little tip, we often experience the feeling of hunger. Once you get to a certain point of hunger, it doesn't get worse. It just kind of plateaus, and sometimes it actually gets better. And that was one of the surprises I experienced when I started trying fasting myself. So some people have to get familiar with what it feels like to have an empty stomach. Yeah.
Yeah, no, those are great points, especially the hunger. If you actually timed it, sometimes it lasts anywhere from a minute to 2 minutes, right? So when you kind of think about it that way, it's a very short span.
That's right.
Now, coffee during fasting. Zanata's asking here, you did discuss the benefits of coffee. What about adding electrolytes?
I'm a big fan of electrolytes during fasting. It can help to mitigate some of the negative effects that people experience. Sometimes people will get things like restless leg or muscle cramping. or they'll just feel really fatigued, and the electrolytes can help with that. Because when you start to fast, you're going to lose quite a bit of water. We store the water with the glycogen and salt as well. So as you start to burn through that, you lose more of that, and electrolytes can be quite helpful during the fast. And it's one of those things that will not stop the mechanisms that are beneficial with fasting, just taking those minerals. Just make sure, obviously, your electrolytes are not sweetened with anything caloric. They can be sweetened with monk fruit or stevia, or not sweetened at all, and that should be fine. And then what was the first part? Coffee?
She was just saying that you mentioned coffee, that it was beneficial.
Yeah, so and also with coffee, it's mainly the polyphenols. So if you don't want to use like a caffeinated coffee, if you want to go decaf, choose Swiss decaf, because that's the best version, and organic, of course. And then those polyphenols in the coffee will still be of benefit, even though it's decaf.
Mm-hmm. Now, they would stick to just one coffee, because more than that, you can stimulate insulin if there's too much consumption.
That's correct. We don't want to push that stress response too much with coffee.
Yeah. So Heather here, she works with women in midlife, where muscle preservation is key. So what are your thoughts on meeting protein goals along with fasting and increasing cortisol with fasting? Many of the women that she consults are already stressed, have increased cortisol, and she's afraid that fasting will exacerbate this response.
Yes. So I think sort of around menopause, premenopausal, menopausal women, we have to be a little bit more careful. And also the older we get, because it becomes more and more difficult to stimulate muscle protein synthesis with any given amount of protein. We can still use fasting strategically. So I would say a bare minimum for fasting would be 12 hours. The research shows that that's really good for the brain. It's really good for preventing certain diseases. So we don't want to be eating all the way right up to bed. It's ideal to have about 2 to 3 hours before we go to sleep, where we haven't eaten anything, so we have an empty digestive tract, and we can work on that rest and rejuvenation stage. And then when we hit the 12-hour mark in the morning, whenever that might be based on your schedule, you can start eating again, and you've gotten a really great benefit of doing that intermittent fasting or time-restricted feeding, whatever way you want to call it. Now, a couple tips as an aside when it comes to protein consumption and muscle protein synthesis is when you're switching from the fasted state to the fed state, you want to take advantage of that response and make it as robust as possible. How do you do that? The first meal of your day, and I say the first meal because sometimes people's first meal is at 8 a.m., sometimes it's at 12 p.m., depending on what they're practicing. That first meal, you need to have at least about 20 to 30 grams of protein, most people. If you have that amount of protein, you can properly activate mTOR and stimulate the muscle protein synthesis stage. If you don't, you will not have as a robust response. So, I was just talking with a client this morning, and we were talking about protein. I said, "Oh, how much protein? Do you have protein in the morning?" She said, "Oh yeah, I have eggs." I said, "How many?" She said, 2 eggs. Do you know how much protein's in 2 eggs? About 12 to 13 grams of protein. It's not nearly enough in order to have that robust response. So what we're looking at is 3, 4 eggs, or having a few eggs with something else as well. Maybe some Greek yogurt, a sausage, a smoothie if you want to do that, whatever way you can get to that 20 to 30 grams. On the flip side, we also see it's important you can extend that muscle protein synthesis response if at dinner time you do the same thing, because then you have a much longer span of time in the fasted state where you have the activation of mTOR. And there was a researcher, I forget his name, but he was doing studies on people who are in the hospital, specifically elderly people who are in the hospital because they landed there due to an injury or some other reason. And they were getting their dinner meal at like 6 o'clock, and then their breakfast was coming at 8, 9 a.m. and their muscle protein synthesis was just going in the buckets. So what they were experimenting with was having a pre-bed smoothie with, I think they used whey protein to get 20 to 30 grams of protein in right before, and it greatly decreased muscle atrophy and muscle loss in that process of being in the hospital.
Mm-hmm. Fantastic. Now, what if someone was doing OMAD for, let's say, 30 days? So they're just having that one meal. How does that shift the protein requirement?
I think part of it, that's a long time to do it, 30 days, that we want to consider how much muscle they have in the beginning and how much fat they have in the beginning. Personally, I do, OMAD is one meal a day. I do a 24-hour fast once a week. I've been doing it for years. And there's certain mechanisms that are at play that help preserve muscle through a short fast like that. So what I'll do is I will eat from dinner to dinner. So currently I do it on Mondays. I'll have my Sunday night dinner. I won't eat till Monday night dinner. And at Monday night dinner, I make sure there's a good bolus of protein. Now, you're only really going to be able to utilize about probably 40 grams of protein at a meal. The rest is just kind of, I'm not going to say go to waste, but you're not really going to stimulate muscle protein synthesis beyond that with that type of dosage. So maybe I'll have another snack or one more meal before I go to bed on that day. But it has not decreased muscle mass or gains at all by doing it that way. If you were doing one meal a day for 30 days, I'd be a little bit more hesitant as to how you're maintaining muscle mass, and you would definitely need to be doing weightlifting in order to have that stimulus to maintain muscle mass as well.
Mm-hmm. Okay, perfect. So weightlifting, this question is in regards to exercising. So exercising in a fasted state, is that recommended for women?
It's interesting because I was listening to a podcast with Dr. Stacy Sims recently, who has just taken the internet by a storm. And she is doing and has done quite a bit of research on women specifically. A lot of the earlier research on fasting was done on men, and obviously it doesn't carry over to both genders. She recommends that women do consume food before working out, and they don't do as well in a fast state before working out. Now, that being said, I still think it's kind of up to the individual and seeing how they respond and how well they perform in the fasted state. Because I do have some friends that just like to eat fasted. Like to work out fasted. I can't work out with eating beforehand personally. It just feels horrible in my belly. I don't know if you experienced that, Elizabeth, but I have to be
personally. I love working out on a fasted state, but that's that's an individual thing.
So at the end of the day, and it's what we do, it comes down to the individual, I think.
Yeah, perfect. Hi, Angela. So Angela was wondering about perimenopausal women, just chatting a little bit about fasting in that lifespan.
Yeah, so I think, again, I'm going to direct you to the work of Dr. Stacy Sims, because she has done a massive amount of work on specifically fasting in perimenopausal women and women specifically.
Excellent.
Now, that being said, just to add a little point here, is that my patient population isn't really just a bunch of perimenopausal women coming to me saying optimize, although I wish it was. So I'm often working with people with specific health conditions, as I mentioned, right? Autoimmune, cancer, digestive issues, all sorts of things. So in terms of using the fasting therapeutically, it kind of trumps the fine tuning that a lot of people are after who are already healthy, right? We're looking for much deeper effects. And what we have learned from the work of Dr. Walter Longo and others is that it has a profound rejuvenation effect. And Essentially, the more you do it and the longer you do it, the more of that rejuvenation effect you get. So it also sort of depends on your goals and what you're after.
Right. Yeah. In regards to, you mentioned organ shrinkage, but not testicles.
Mm-hmm.
Is there any study that you've come across in regards to the ovaries?
Oh, that's a good question. No, it didn't mention that in the book.
Yeah. And Stacy's curious about how would you proceed in supporting women with fasting or people with adrenal fatigue? Again, that was
Yeah,
probably menopausal women. Yeah.
yeah, adrenal fatigue, we need to be a little bit more careful because it can create a stress response in the body. As we saw some of those counter-regulatory hormones like adrenaline, we're going to push the adrenals to kind of kick in and help. We have to understand that when we deviate from the norm, typically, we're putting a stress on the body. And the goal with anything in holistic nutrition and functional nutrition is we're trying to push people within a range that helps to improve them, but not stress them too much. So we also see that with, cold and heat therapy with that hormetic effect. Cold plunging is great, but you can overdo it. Same with heat exposure. And same with exercise. When you're exercising, it's a stress on the body. You tear up the muscles. You don't want to go too hard, but you don't want to not do anything. And in that Goldilocks range, you get that hormetic effect where you're building up and getting stronger every time. So it's the exact same with fasting. Most people are used to having calories in all the time and having access all the time, especially to carbohydrates, which I could talk about a lot more, but I won't go into here. So when you start restricting that, you're changing your metabolism. You're pushing certain pathways that have never been pushed before, and that can be uncomfortable at first. And this is what I alluded to also in my talk about metabolic flexibility. That metabolic flexibility is your ability to change from using different energy sources, from carbs to fats, even protein sometimes, or amino acids, and even ketones. People's metabolic flexibility has decreased substantially because of our access to calories. So sometimes we have to train that and go slowly with people. Doing an overnight fast for 12 hours or 13 hours sometimes is a big step for some people because they're snacking every night after they have dinner. And then we can push, 1 hour at a time, 1 hour at a time, and play with that depending on the individual.
Beautiful. And can fasting reverse type 2 diabetes?
Absolutely. There's work by Dr. Jason Fung. Jason Fung was, I think, a nephrologist who popularized and utilized a ketogenic diet to reverse type 2 diabetes and kidney failure, essentially. So yes, it can definitely be reversed as long as it didn't go too far.
Right. Yeah. And Joy is wondering about the recommended protocol, but again, that would be individualized.
That's right. There's so many different protocols out there. And my best advice would be just to start playing around with yourself. One of the things I tried when I first learned about this too was intermittent fasting and skipping breakfast. Skipping breakfast did not work for me. I just couldn't get in what I needed to in doing the rest of the day. So that's why I've also tried 5-day fasts. I love those. I feel really great on those, but you're really affected socially. Not so great if you're with a family. But the 24-hour fast 1 day a week really worked well for me. I felt great. It rejuvenated my brain. I felt on for those 24 hours. It was easy to do socially because it was dinner to dinner. I didn't need to have my breakfast and lunch. And so that's kind of what stuck for myself. But yeah, just play around with it. And then also just look at some of the research. So Walter Longo has a specific protocol and something called the fasting mimicking diet, which literally comes as a kit with what you can eat every day of those 5 days. So it's like a no-brainer. I don't love it. I've created my own fasting mimicking diet based on the mechanisms at play. And you can get the same benefits that way. You can get the same benefits from a 5-day water fast. He just created it to make it easier for people. So he gives specific protocols on how he uses that fasting mimicking diet in his book.
Mm-hmm. Excellent. And what about fasting for children? Would it be safe?
I wouldn't recommend it. Yeah, children need to grow. They need all the calories they can get. They actually have their hormones are working in a bit of a different way. So, as I spoke before about making sure that there's a big bolus of protein, especially first thing in the morning, children are a little bit different based on their hormones because they can actually have little bits of protein throughout the day and they utilize that really well. And that can actually help and maintain muscle protein synthesis. So they don't need to have these big things. They can actually have lots of little snacks. But in a growth phase, which children are, I would not really experiment with fasting. They're already doing it if they're sleeping through the night and not
Yeah.
eating overnight.
And listening to them, right? There's so many children that actually do not like breakfast, and
That's right.
forcing them to have breakfast would not be advantageous, right?
Yeah. I
So
would
that's
also say on the discussion of children too, they also don't always need to be snacking
mhm.
and always have food around, you know?
I'm glad you said that. Yeah.
Let them have little spans of time where there isn't a snack in your back pocket. You're going for a hike for an hour or two, you don't need to bring food. So
That's
you can
it.
experiment with little chunks of time as well.
Yeah, very nice. And do you recommend fasting approaches for women who are still menstruating versus postmenopausal?
Yes, I would. I find that women do worse fasting while they're actually menstruating. So before or after is probably a better idea, just because I think the body's being depleted during that time. So you can kind of cycle in and out of it as well. Yeah, so I
Mhm.
would recommend it for women.
Great. And what about individuals with dementia or Parkinson's, Alzheimer's?
Um, Crucial. I think fasting can be extremely helpful because what we do, I mean, Alzheimer's is sometimes called type 3 diabetes because of what sugar can do to the brain and how it can damage the brain. So it's discussed quite a bit in Dale Bredesen's work. Dale Bredesen wrote The End of Alzheimer's, and he started with 10 patients in his first pilot study who had Alzheimer's disease and basically went through a list of 36 items that he optimized. A lot of researchers didn't like his work because it wasn't like one controlled item, but he slowed or reversed Alzheimer's in all of his patients. And then he went to a bigger study of 100 people. And now his work is known internationally. But one of the parts of his program is making sure that you have an overnight fast and also reducing carbs substantially. Another big proponent of the ketogenic diet for brain health is Dr. David Perlmutter, which has worked a lot with Parkinson's and Alzheimer's disease. I'm working with a client right now who has Parkinson's, and we're just trying to reduce symptoms and reduce medication. And we've incorporated as a first step the ketogenic diet for a number of days during the week, and we're cycling in and out of that. So again, the fasting was a bit too aggressive to do at first, and we can ease people into it. And actually, the ketogenic diet is a nice gateway diet to get them there with a little bit more grace, because you can still have the calories, but it starts to get you to produce ketones and feel what it's like to have a restriction of carbs and a lower level of carbs in your diet.
Great. We appreciate your time, Josh. You have lots of questions, so we're just going to take a couple more, but Josh does have to go at 4:30 Eastern. So in regards to ketones, how long does it take to get into the ketosis state? And then how long would it take the body to start digesting the last meal in terms of hours?
Right. So it takes about 5 to 6 hours to see your blood sugar start to come down after eating a meal, maybe even sooner, depending on your metabolism. It will take probably about a minimum 24 hours before you get into ketosis. So at the end of a 24-hour fast, you're maybe getting into mild ketosis, depending on the amount of activity you're doing. One way you could speed up that process and get to ketosis much quicker is to do some activity. You can work out, you can go for a long walk, a long bike ride, and that will start to burn the glycogen that's stored in the muscle. Remember the fridge on your main floor? And the glycogen in the liver. That's what you're going for. Remember, there was about 2,000 calories there that you need to get through. That's about a day's worth. So once you get through the glycogen in your muscle and liver, then you're going to start to switch and change to start to make ketones. There's different ways you can measure this. You could use urine test strips, which will basically measure acetoacetate. So it's good for the first little bit, but then when you switch over and start to make more beta hydroxybutyrate, it's not the most accurate. The number one way to test ketones is using blood, like a skin prick. So you can get that in any drugstore as well. But it's about 24 hours to 36 hours.
All right, excellent. And Graves' disease, do you have any experience with your clients that have Graves' disease in regards to fasting?
Yes, well, there's a lot of research on using the fasting mimicking diet and fasting for all autoimmune. So Graves being, autoimmune hyperthyroid is just one of about 80 autoimmune diseases, which all have very similar mechanisms at play. And what Walter Longo discusses is that when you fast, specifically like a 5-day fast, a lot of the immune cells that have been programmed to attack your own tissue can be cleared through the process of autophagy. And when you start eating again, which is, as I mentioned, is the 1-2 punch, you rebuild back your immune system and re-educate it, and it can lower the autoimmune process. We saw that in the study that I presented at the end with the multiple sclerosis. They've also done one with type 1 diabetes, the autoimmune version of diabetes. I'm not sure if there's other studies for other autoimmune diseases, but it would be a really powerful tool, I think, in any autoimmune disease.
Josh, it's been an absolute delight to see you. Thank you for joining us today.
Likewise, thank you so much for having me. It's always fun chatting to the group.
Amazing. Thank you, everyone, for coming. Josh, we look forward to the wonderful work you are doing and will continue to do. Thank you so much.
Bye, everyone.
Bye-bye.